Hello, friends. I'm Compatible. Is gender confirming surgery necessary? Do I need it? To what extent do I need which surgeries? And the answer is I don't know. You know, I know I don't really feel okay. I'm really good at stuffing my feelings and being unstable and having anxiety. That's just what I've done my whole life. So I don't know what normal is. I really don't know what okay feels like. I don't know if I ever will. Am I okay? Well, I'm not suicidal, you know, I lived with a ruptured and disintegrated L5S1 vertebral cartilage. It was destroyed. I didn't have a disc. And I lived with that for years. I did hard labor with that condition, and it was incredibly painful. And I was not okay none of the time. But on any given day, if you'd asked me if I was okay, I'd have kind of agreed, yeah, I'm okay. Because I can bear the pain for one more moment, and does this compare to that? Well, no. It's very difficult to have a stable relationship as a transitioning person, I have goals for who I'd like to be, how I want to be on the other side. But this is very difficult for a potential partner that's a lot to ask of someone. Yeah, I have these parts, but I'm going to go and have them reconfigured. They're going to be different. I have this hormonal temperament, but I'm taking this medication to change it, or I'm getting this surgery, and once the surgery is done, I am going to be a different person in some ways. I'm transitioning, and these are my goals, but it's going to take years. And starting a new relationship, I don't know. I can't really fault the people who are willing to just take a pass on that. They're willing to be look, let's be friends. Let's not take it anywhere romantic. Let's wait and see. And so then, I have all these relationships in my life that are kind of on hold in one way or another, or at a distance in one way or another, or just like my career has been on hold for several years while I've been doing physical therapy, trying to get my neck fixed, trying to get my nervous system back in some kind of equilibrium where I can function. And my career has been on hold. It's not a fun place to be. I'm always off of my center. And how long can I do that? Well, I don't know. I might be able to endure that, but it is torture. I don't want to. I wouldn't wish it on anyone, I don't think I don't think it should have to be that way. I don't think I should be pushing people down to jump in front of line to get in for my surgery, right? If somebody's having an acute urological condition, they have a kidney failure or something like that, they should absolutely get treatment for that before me. But this urologist only needs a 1 or a 1.5 hour slot to schedule me in for my orchiectomy. And they've got it on the 18th of December. So I'm not getting in anybody else's way. Very abstract, the way that hospitals and doctors bill and make money. The money isn't being wasted. The insurance company needs to have the hospital on retainer to do surgeries that are necessary and in emergencies. The anesthesiologist who is going to put me to sleep so that I can have my surgery done still needs to pay their mortgage that week. They still need to make their money. So they're going to go to work. And if there's no one to put to sleep, then then they're just going to sit there and do nothing. And their time is going to be wasted when the hospital pays them to do nothing. The things like me being greedy for wanting to get this treatment, or it being wasteful of money for certain people, they're very abstract things. And I'm not going to let them stop me from hopefully relieving this condition that makes me very uncomfortable. I don't have to feel like, if this is what you want for your transition, that this is something so obscure or so strange, or that it's selfish of you or wasteful of you to ask for these things. I know that's what I was taught when I was younger. And I need to unlearn some of the things that, I don't know, maybe 20 years ago, this was an unrealistic thing for a person who wanted to transition to ask for. I don't know. It's not now. Okay, so my urologist at the Women's Hospital here in Pittsburgh has only been there for a year and a half. And in that time, they've taken the steps to establish themselves as someone who's willing to provide care specifically to transgender patients who have urological needs. And so that doesn't like happen like in a flash. There's not a huge backlog of people who think they can even, like, they've already been told, no, we don't have anybody here in Pittsburgh. So they're automatically seeking elsewhere, so it takes time for that. But in that year and a half, when I call scheduling, they said, oh, you want to talk to this woman at this hospital, she will be able to help you. And so I went there, and the woman who did my intake, I was the first transgender woman that she'd ever met. So, I mean, in that office, they're still just learning. At a year and a half ago, there was nothing, And so when I think of, well, where would I have gone? What would it cost? How would I have addressed this 20 years ago? It was very different. Even 5 years ago, 3 years ago, how I would have to approach my transition was different. So things are changing. And the only way I know how it's working is I have to ask. And sometimes I have to ask again and again, and politely. I don't have to get upset, but I have to be confident that the needs that I have, the things that are going to make me whole in my transition, that it's reasonable for me to ask. I mean, they can just as reasonably say no, and I can seek elsewhere. It takes a lot of confidence. It takes a lot of courage. And by courage, I mean I need supports who will re-encourage me, reinvigorate me, because it sucks hearing no. It takes so much emotional energy to ask these tough questions. Like, I have to go up and out myself to complete strangers who I have no idea who they are or what they're going to think. I have to say, I'm a transgender woman, and I'm seeking urological surgical care. I have to have educated myself to know exactly what I want to ask for, because they don't know what I need. And then I need to be willing to accept no. And I need to be ready to add the but. And they say no, and I say, okay, but is there anyone else? Who else would you recommend I talk to? Is there a reason why you can't provide that care? Can I educate you better in what my need is and why it's reasonable for me to be asking and why it seems strange? Like I need to give some pushback. I do. Not every younger transgender people, they can't be expected to do this work. Ladies, this is the job of mature transgender people, to be responsible, to step out with courage, and use the skills the life skills that we have learned to blaze a trail, to not let people just turn us away, to not let people use, the same old excuses, well, that's against my religion. That's not a valid reason to not provide somebody with health care. The standards of care are written, and we need to learn them and be confident about them. We need to advocate for ourselves and for each other. And it is a lot of work. And it's a big conversation that we need to be having. We need to have it again and again and again. And it seems, inside our bubble, it seems like we're just repeating ourselves. But new people are coming into our community all the time. And we need to have people who are energized to talk about these issues, And so once I lose my energy, or if you have lost your energy to talk about it, we need to be prepared to push someone else to the front of the line to do it. So we need to mentor. Mentorship needs to be super important. This is how other organizations do things, and we need to carry that experience and that knowledge into getting good transgender care. A thank you to all of my trans friends on YouTube and some other platforms who regularly encourage me and have helped to educate me, have put up with me. I love you all, and I really value all the support that I get on a regular basis. And if there's anything I can do, or if there's anything I'm doing wrong, we can do this together. We need to do this together. There's no reason anyone should have to figure this out on their own. And thanks for watching. If you can, please like and subscribe, and I will talk to you soon.